I'm Kelly. I'm going to be your student physical therapist today.
Hi.
What's your name?
I'm George Flooney.
Hi, George. How are you doing today?
I'm doing well. How are you?
I'm good, thank you. So it looks like your doctor sent you over for some neck pain and then kind of some upper back pain. Is that correct?
Yes.
Okay. Have you ever been to physical therapy before?
No, I haven't.
Okay. Well, just so you kind of know what we're going to do today, first we're just going to kind of sit and chat for a little bit. I'm just going to get to know you, kind of what your standard day is like, and then get some more details about what's been going on with your neck pain.
Okay.
And then after that, we'll go into the objective part, which is when I do some tests and measurements and things like that to figure out what exactly is going on and what we can do to help you.
Awesome.
Okay. So just some basic information first, and I'm going to be jotting a few things down while we talk, if that's okay. So what's your age?
I'm 56.
Okay. And what do you do for work?
I'm a cybersecurity contractor.
Okay.
And so, yeah, that's a lot of desk work,
Okay.
sitting a lot.
How many hours a day are you working?
About 6 to 9 hours a day, 5 days a week. So,
It's pretty long days.
yeah, long days, just very tiring.
Yeah, I hear you. When you're not working, do you have any hobbies or exercise that you like to do?
I really just like to play with my grandkids and just kind of hang out. Oh, I also play pool. And
Cool.
yeah, at this bar down the street from my house, and I'm really good at pool.
Nice. I'm horrible. I just try to hit the ball as hard as I can and hope it bounces in somewhere. So I don't think that's really how you're
No,
supposed
I
to do
used
it.
to be like that a long time ago, but now, no. I'm very good at pool.
And how many grandkids do you have?
I have 3.
Oh, boys or girls?
2 girls and a boy.
So sweet. Okay. And what kind of housing situation are you in? 1-story house, apartment, 2-story?
I'm currently in a 1-story house.
Okay.
I live there with my wife.
Okay, good deal. Any trouble like getting around as far as like your neck pain with doing stuff in the house?
No, not too bad.
Okay, perfect. All right. Well, why don't you go ahead and can you describe your pain for me?
Yeah, so it's kind of like in this area right here.
Okay.
Just kind of.
Yeah, just point to where it is for me. Okay.
Yeah. So yeah, it's just kind of like a dull, achy pain,
Okay.
and it's always there. It never goes away. I can never get it to quite go away.
And is that the only place you have pain?
Yeah, so it's like right in the middle here,
Mhm.
and then kind of like goes down a little deeper this way.
Okay. Kind of on either side.
Yeah.
Okay.
And that one right here, it kind of just feels like a sore feeling. I don't
Okay.
know how to describe it.
So the one that's constant in the middle, what would you rate your pain on a scale of 0 to 10, where 0 is no pain and 10 is the worst pain of your life, just sitting here right now?
It's about a 4 maybe right now.
Okay. And what about when it's at its worst?
It gets up to about a 6.
Okay. And at its best?
At best, probably about a 2.
Okay. And you said it's constant. Is there any numbness or tingling that goes along with that? Okay. And what about the other pain that's a little farther down? What would you rate that pain right now?
That one's probably at about a 1 right now.
And at its worst?
About a 4.
Okay. And at its best?
I guess probably about a 1 is its best.
Okay. And have you noticed at all like a relationship between the two? Like if your pain gets worse with one or the other?
This pain always comes on first, this one right here in the middle.
Okay.
And as this one gets worse, I start to feel the pain a little lower.
Okay. So it's always that center pain first, and
Yeah.
then it kind of spreads as it gets
Mhm.
higher. Okay. And are you having any pain like down your arms or in your shoulders,
No.
anything like that?
No.
And what about into your low back
No.
and like abdomen or legs or anything
all of
like
that
that?
is fine. It's just been this kind of lower neck area.
Okay. So I have a little picture here, and you just let me know. Does that look pretty accurate for where your pain is?
Yeah, just like that.
Okay, great. All right, so moving on, I want to know like what kind of things make it better or worse.
Okay.
So talking about the center pain first, right there on your spine, what type of things make that worse?
Well, like I said, I do a lot of sitting at work, so it's usually after about 2 hours of sitting that I really start to feel that pain.
Okay. And anything else besides just working?
Sometimes when I'm playing pool, I kind of have to look down and kind of put my neck up like this, and that bothers it a little more.
Okay, so when you're kind of coming back up to look at
Yeah.
the pool stick. Okay. And how long do those things usually take before they start feeling better?
I usually just kind of try to stretch my head side to side, and that usually goes away in about 4 or 5 minutes.
Okay. And any other things you do besides stretching to kind of ease your pain?
I also sometimes will take just some pain medicine for it, and that usually gets it to go away in about 20 minutes or so.
What type of pain medicine are you taking?
I'm taking Advil.
Okay. And is it just over the counter?
Yeah, it's just from the Walgreens next door.
All right, sounds good. And then as far as the lower pain between your scapula there, is there anything that specifically aggravates that pain?
Well, kind of like I was telling you earlier, when this pain starts, this pain gets a little worse. That one probably a couple hours later. So if this one takes 2 hours, the lower one probably takes maybe 4 or so before that one starts to really bother me.
Okay, so you're getting about halfway through your workday, and then it's getting pretty tough for you
really
to keep
bad in
steady.
both areas.
Okay. And things you can do to make that second one feel better? Anything specific?
I think really the only thing that helps that is just to kind of lie down. Sometimes I have my wife kind of massage that area, and that will relieve some of the pain.
Okay.
So.
All right. Well, why don't you walk me through like what an average day is for you?
Okay.
How does your neck pain feel in the morning?
In the morning, it feels pretty bad when I wake up. It just kind of like stiff and sore, like I was telling you.
Okay.
And then, like I said, progressively it gets worse throughout the day at work just because I'm sitting so much. And then, I guess when I get home from work, it hasn't really changed too much. It's still kind of like that stiff and sore feeling in the back there.
Do you have any trouble sleeping?
No, I don't.
Okay. All right. And next thing we have to go over is the history screening form. So
Okay.
appreciate you filling that out for me. So it looks like here you are managing high blood pressure,
Mm-hmm.
And then doing some diet modification right now.
Yeah, I've been trying to eat a little healthier. I've gained a couple pounds in the last few years.
It's
so.
hard to eat healthy.
It
I
is.
always
It's
try.
so hard.
It's
I
rough.
love those potatoes.
Hey, it's the pizza for me. All right. So as far as family history, is there any like history of cancer or diabetes and anything like that?
No,
Okay.
nothing like that.
And any personal history other than what you've given me here?
I actually fractured my collarbone about 4 years ago.
Okay.
I fell out of a tree.
Oh, wow.
Yeah.
That can't be
I was
fun.
hunting, and I thought I had him, and
Mm.
I did not. So, yeah, but that's healed. That's healed
Okay,
fine.
good.
That's doing a
Good.
lot
Glad to
better.
hear it. Doesn't give you any problems
No,
these days?
no.
Okay, good. Glad to hear that. All right. And just a couple of other just general questions. Have you like noticed any change in your bowel or bladder movements
No.
since this has been happening?
Nope.
Okay. And have you gotten any sort of x-rays or any imaging done since the
No.
neck started bothering you?
I haven't.
Okay. And let's see, you said you were taking some pain medication over the counter. Is there any other medication that you're taking?
I take about 800 milligrams of ibuprofen
Okay.
and Lasix.
Okay. And why don't you just go ahead and tell me what happened with the neck? So
Okay.
when did the problem start?
So over the past 4 months, it's just kind of been getting worse and worse, and nothing really happened. There wasn't an event or anything that caused this pain. I've been feeling it more and more, and like I said, at work and when I'm playing pool, I just feel it a lot over the past 4 months. And then this other pain came on a little later. At first, I was just having this mid pain right here, and then it was probably about 3 months ago that the side ones started bothering me.
Okay. Have you ever had a pain like this before, like any neck problems in the past?
No, I haven't.
Okay. And no surgeries or anything in that area?
No.
Okay. All right. Well, we're going to go over a few things here today that can hopefully help start easing your pain.
Okay.
And after we take some measurements and do a couple tests, we'll get started on that.
Okay.
Do you have any questions for me right now?
No, not really.
Okay. And as far as the exercises that I'm going to teach you in the clinic, we're going to send you home with a couple that
Okay.
you can work on in between our sessions. And so do you prefer like to learn by seeing somebody do it or me explaining it to you, or what's best for you?
Probably seeing things, and then maybe if we could walk through them with me so that I could kind of see what it feels like so that I could just be able to do those at home.
Yeah, absolutely. So we'll walk through it. I can demonstrate for you first, and then we'll walk through it together. That way we get a hold of those. And then what are your goals for physical therapy?
I really just want to be able to work without pain and just be able to move my neck just the way that it was moving before. Mm-hmm. And yeah, just get back to playing with my grandkids, playing pool. I told you I'm really good at pool.
Yes.
So, gosh, I'm just so frustrated with this neck pain.
Yeah. It could be really tough, especially when it interferes with you doing what you want to do. So I totally understand. So we'll definitely get a better idea of what exactly is going on after going through the objective exam and doing a couple tests. But I think that we'll definitely be able to work on an exercise program that'll help you, and then do some things in the clinic and also, like I said, at home. Mm-hmm. So as long as we're both working together, I think we'll get you feeling better soon.
Awesome. Thank you.
All right. And last but not least, did they give you an outcome measure to fill out when you came in today?
Yeah, they did. The Neck Disability Index, I believe that's what it's called.
Okay. What was the score on that, if you know?
I think it was an 18.
That's right. Yes. All right. Perfect. Thank you for that info. All right. And if you don't have any questions, we'll go ahead and move on to the objective exam.
All right. Sounds good.
Okay, Mr. Flooney. So we're going to go ahead and get started on the objective part of the exam. Okay. So for this first part, I'm just going to do some quick observation of your posture. Okay. So if you could go ahead and take your shoes and socks off for me. And then also, if you don't mind, if you could go ahead and remove your shirt for this real quick. Okay. Normal man. Okay, and if you could just sit comfortably, like as you would in your office. Okay. Okay, and go ahead and stand up. And if you could turn and face that direction for me. And turn and face this opposite wall. Okay, next thing we're just going to do a little bit of walking. So let me move this stool out of the way. And if you could just walk at your comfortable, regular pace, just down to the edge of the room and then back. Okay, and you can go ahead and put your shirt back on. Next, we're going to do a little bit of balance. Okay. So first, I'm going to have you try to balance on one leg at a time. So you can use the table here if you need to help yourself balance a little bit, but try not to depend on it completely. Okay. So just on your right foot, try to balance as long as you can. And we'll do that for 30 seconds. And 30. And switch. Okay, great. And last thing, if you could just walk for me, and I just want you to put your heel in front of your toe just like this. Okay. And you can just turn and walk that direction just like we did before. Okay, and you can turn around and come back. It's kind of hard. Yeah, that one can be tough. Okay, perfect. So next what we're going to do is just double check that none of your problems are coming from your shoulders, because sometimes those can create pain in your neck or your back. Okay. So go ahead and sit down for me. I'll lower this down. And to do this, we're just going to go through a couple motions, and then I'm going to put a little bit of pressure at the end as long as there's no pain, just to make sure, like I said, that none of your pain is stemming from anything going on in the shoulder. Okay. So starting with your left arm, just lift that up towards your head as far as you can. Any pain there? Nope. Okay, so I'm going to do a little bit of pressure. Pain. Okay. Now reach behind your head like this.
Okay.
Any pain there? Okay. And now behind your back. Good. All right. Same thing on the other side. Arms straight up. Okay. Good. And behind the head. Okay. And behind the back. Anything there?
Nope.
Okay, great. Next, what I would like you to do is, can you just show me something that reproduces your pain?
Well, like I said, when I'm sitting at my desk, so really just this position like this. I guess when I play pool too, I kind of have to get a little bit low like this,
Okay.
and that really bothers it. So
Okay.
kind of this like upward motion.
So what about like when you try to look up?
Just look up with my eyes.
Like look up with your
Oh.
neck. Move your neck
Oh.
to look up towards the sky.
Sorry. That is a little bit painful.
Okay.
Kind of hurts more to come out and up.
Okay.
If that makes sense.
Yeah, absolutely. All right. Well, next I'm going to measure some of the motions of your neck. So I'm just going to have you go into a couple different movements, and then depending on if there's pain, I'm going to apply a little bit of pressure just at the end of the range.
Okay.
So that it's going to require me to place my hands on you, on your head and neck and shoulders. Is that okay?
Mhm.
Okay. So first one, I just want you to tuck your chin down towards your chest, and then just kind of roll your head forward. Okay. And then come back. And how'd that feel?
I kind of felt just a little tight, but
Okay.
other than that, it was okay.
Okay. So go ahead and do that motion one more time.
Okay.
That feel okay?
Yeah, same thing. Just kind of a little pull in the back.
Okay. Next one, I just want you to tilt your head back like you're trying to look up at the ceiling.
Okay. That kind of hurts.
Okay. Pain with
That
that?
feels a little stiff.
Okay. And I'm going to just do a little bit of overpressure with that. So go ahead and do that same motion.
Okay. Yeah.
Pretty tight there.
Mm-hmm.
Okay. Next one, I just want you to bring your ear towards your shoulder.
Okay.
How's that feel?
Just a little stiff, but not too bad.
Okay. And same thing to the opposite side.
Okay. Same. Just a little bit stiff.
Okay. Last one, I just want you to rotate your head to one side.
Okay.
How'd that feel?
Just the same, a little bit stiff at the end.
Okay, and same thing to the opposite side. Last one here. Same thing.
Yes.
Alright, so kind of some general stiffness going on there. Next thing I'm going to do is actually measure the amount of range that you have in each of those directions.
Okay.
So for that, I'm going to use these little tools. I'm going to place them right here on your back and then one on top of your head. So let me get those.
Yeah, sorry, I've been growing it out.
Okay, and go ahead and tuck your chin and then nod forward. Okay, you can relax. Okay. It's normal. And now go ahead and try to bring your chin up towards the sky. Okay, relax. It's 40 degrees. And now let's try to bring your left ear towards your left shoulder. Okay, relax. 45. And right ear towards the right shoulder. Relax. Okay, let's go on this one, good rotation. Okay. So if you could scoot back on the table just a little bit towards me. And go ahead and rotate as far as you can to the right. Okay, and relax. And as far as you can to the left. Okay, nice. Good job. All right. Next thing we're going to do is just a quick test to see if any sort of side bending with pressure added to it is going to cause you any numbness or tingling or pain or things like that. So let me know if it reproduces your pain or causes you any discomfort. So for this, I just want you to bring your right ear towards your right shoulder. Okay. And then I'm just going to apply a gentle pressure here. How'd that feel?
That was okay.
Okay, and same thing to the other side. How'd that feel?
That was alright too.
Okay. Next, I'm just going to do a quick test of the muscle strength in your rotators that move your head from side to side here. Okay. So go ahead and rotate it a little bit to the right. And I'm going to apply a little resistance. You just don't let me move your head, okay? Okay, ready? Hold, hold, hold. Okay. And rotate to the opposite side. Don't let me move you. Ready? Hold, hold, hold. Okay. Any pain with that?
No, that was okay.
Okay, so next thing we're going to do is a quick test on the strength and endurance of your neck muscles right here in the front of your neck. So sometimes those can get weak if you're working at a desk a whole lot and you're kind of pushing your head forward to work at a computer. And a lot of the time that can cause like some tightness in other muscles and some sensitivity in your neck and your back. Okay. So go ahead and lay down on your back for me. And the first step of this is I just want you to try to bring your chin towards your chest and just hold that. And I'm going to make a quick mark here. Okay. And now what I want you to do is try to lift your head up off the table and hold that for as long as you can. Okay. All right. Perfect. So it was about 5 seconds. So that's definitely something that we can work on when we get into our exercises and stretches that we're going to start with later on. Okay. Awesome. Alrighty, so we're almost done here. The next thing I'm going to do is just a little bit of palpation, which is basically just me kind of feeling along the muscles and the bones right along where your cervical spine is, which is your neck, and the muscles that kind of attach there, and figure out if there's any tenderness or swelling or things like that that might be contributing to your pain. Okay. So if you don't mind, I will have you go ahead and remove your shirt again for this part. Okay. And then I'm going to have you lay on your stomach right here. All right, and you can just let me know while we're doing this. If you feel any pain, you can just wiggle one of your fingers at me. That way I know what's going on, okay? Okay. Sorry. Oh, no, you're good.
No, just a little stiff.
Okay. Wow.
It's
A little tender in this muscles. That on this side.
Yeah, same thing.
Okay. All right, you can go ahead and sit up for me. So after doing all those tests, how are you feeling now? How's your pain?
It's probably about the same. Kind of like a 4 like earlier.
Okay. Well, after doing all that, it looks like there is a little bit of restriction in your motion. So trying to look up, and then bending to the side, and then obviously you're a little tender in some of the muscles back here in your upper back. So I think what we're going to try is a quick mobilization, which is basically I'm just going to be working a little bit on those joints that are stiff to see if we can get those moving a little bit better, and then see if that can help ease some of your pain, and then we won't have as many problems trying to look down at the pool stick and those types of things that you were saying.
Okay.
So we're going to go ahead and do that first, and then after that I'm going to give you an exercise to kind of reinforce what we did, and then we'll see where we are from there.
Okay.
All right, so I'm going to go ahead and have you back in the same position.
Sorry.
I'm just going to be doing this for about 30 seconds. And again, just wiggle your fingers if you feel any pain. Okay, go ahead and sit up for me. And go ahead and put your shirt back on. How did that feel?
It's fine.
Okay.
I feel good.
All right, so let's see after that if that helps improve your motion at all. Okay. So go ahead and try to do that kind of extension movement where you were saying it bothers you when you play pool.
That does feel a little better. Go a little farther.
Okay, so you feel like you can move a little bit farther? Okay, good. That's what we're looking for, so that's a good sign. So we'll continue to kind of progress that as you're here, and that'll be one of the treatments that we start out with.
Okay.
Another thing I want to show you is called chin tuck. So for this, you're going to be laying on your back, and I want you to have your head supported by the towel right here. Okay. And what we're going to be doing for this exercise is I basically just want you to try to bring your chin straight down towards your chest, almost like you're trying to give yourself a double chin. Okay. Yep, just like that. And what that's going to do is it's going to help strengthen up your muscles here a little bit, and then also stretch the ones back here.
Okay.
So we're going to do that exercise. Let's try right now to do 5 repetitions, and I want you to hold it for like 5 seconds each time.
Okay.
Okay, how did that feel?
That felt fine.
Okay. So we'll do about 3 sets of those, but we can take a little rest here, and then that'll also be one of the things I send you home with to work on.
Okay.
Okay, so you can go ahead and sit up. Okay, George, so that's all we're going to do today. And I think that we've gotten a lot better idea of kind of what's going on with your neck. So what it seems like to me is you have some stiffness and sensitivity back here, kind of right at the bottom of your neck where it meets your thoracic spine, which is kind of your upper back. So that can happen a lot from what's called your facets, which are little joints that are in between each one of your vertebrae.
Okay.
So if those get irritated, or if you're, doing repetitive motions, or like your job where you're sitting and hunched forward a little bit, that can put stress on those joints, and that can cause the pain that you're feeling farther down here in between your scapula. So I think if we work on getting those to move a little bit better, which is what we did when I was working on you doing the hands-on mobilization, and then also give you some exercises to take home, like the chin tucks and a couple other things, that those will loosen up a little bit and get that area moving a little bit better, and then that'll help decrease your pain and get you moving in the right direction.
Okay.
Sound good?
Yeah, sounds great.
Okay, so I'd like to see you maybe one more time this week, since it's Monday, if you're able to.
Okay.
Get back in on the schedule at least once, and then maybe like twice a week for the next 4 to 6 weeks, and we'll get you, working towards those goals to get back to playing with your grandkids and beating everyone in pool and all that good stuff.
Okay, sounds good.
Okay. All right, any other questions for me right now?
No, that's it.
All right, well, thank you so much for coming in today.
Thank you so much.
We'll see you soon.
Appreciate it.